Were you aware that in most states you'll get only one chance to enroll in a Medigap plan with no health questions asked? That's right, and many people who are unaware miss this window and later find themselves unable to qualify. Hi, I'm Danielle Roberts, and in this video, I'm going to explain your one-time Medigap open enrollment window. We'll go over who qualifies and when, and we'll also cover what happens if you miss this window. Stay tuned until the end to get our free guide that explains the differences between Medicare Advantage plans and Medicare supplements. You won't want to miss it. Medigap plans are policies that you can purchase from private insurance companies that pick up where Medicare leaves off. These policies will help to pay for things that Medicare doesn't, including your Part A and B deductibles, your co-pays, your co-insurance. Now, these policies are important for many people because who can afford to pay 20% of the cost of, say, knee replacement surgery or 8 weeks of chemotherapy? However, there are many people out there who totally miss the boat on qualifying for a Medigap policy because they just didn't know their open enrollment window for Medigap only happens once. Your one-time Medigap open enrollment period starts with your Part B effective date and it runs for 6 months. During this window, you can apply for any Medigap plan that you want, including the popular plans like Plan F or G or N from any insurance company that you like. You are guaranteed to be issued the coverage without any health questions asked. Once this coverage is enforced, no one can take it away from you unless you fail to pay your premiums. These policies are also automatically renewed each year, so you can never be dropped for developing a new health condition in the future either. However, people new to Medicare at age 65 often don't realize that once their 6-month window is gone, you usually don't get a second chance to apply without health questions in most states. Where people go wrong is when they misunderstand the annual election periods and what those are for. For example, Medicare has an annual election period every fall from October 15th to December 7th. This is the window when you can change your Part D drug plan or a Medicare Advantage plan if you're enrolled in one of those. It has nothing to do with Medigap plans, and it's not an opportunity to enroll in a Medigap plan and be guaranteed an approval. However, some of Medicare's terminology confuses people and they make assumptions that are just not correct. After all, the term annual election period or open enrollment period sounds like a time when you could sign up for whatever you want. And in fact, this is such a common misconception that if you watch some of our other videos here on YouTube, you'll hear me warn people about this fairly often. Now, I want to mention a couple of exceptions where someone could get more than one Medigap open enrollment period. The first one is for people who've qualified for Medicare under age 65 due to a disability. These people will get an open enrollment period when their Part B first becomes effective, even though they are under 65. They'll get a second open enrollment period later when they finally turn 65 and they transition from disability Medicare over to Medicare age-in benefits. This is important because in some states, people cannot get Medigap plans under age 65. So for these folks, it's really crucial to be given that chance at guaranteed issue of a Medigap plan when they turn 65 and now can finally buy a policy. The second exception is for people over 65 who go back to work and regain health insurance from a large employer. If they cancel Medicare Part B because they now have employer insurance and then later they retire, they're going to rejoin Part B, so they'll get a new open enrollment window to enroll in a Medigap plan without underwriting based on their new Part B effective date. Now, lastly, before I sign off, I want to mention that there's several states where the rules are more lenient. If you live in Washington, Maine, New York, Connecticut, Missouri, Oregon, or California, you'll have some additional times when you can get a Medigap plan without health questions. To learn more about those, you can visit our blog post about guaranteed issue windows. We'll link it up below in the notes. So there you have it. We've explained the Medigap open enrollment window and what it's all about. Do you have a question about applying for a Medigap plan? I would love to hear it. Put it in the comments below and I will definitely answer whichever question you have. Now, if you are new to Medicare and you're still learning about the different types of coverage that you can buy to fill in the gaps in Medicare, check out our free guide that explains the differences between Medigap plans and Medicare Advantage plans. I'll put that link in the description below as well. And if you would like to be notified right away whenever we post new videos about Medicare here on our YouTube channel, please hit the subscribe button now. Thanks for watching and we'll see you in the next video.